Eric Cantor, the number 2 Republican in the House of Representatives, says the Speaker of the House is, quote, living in another world, end quote, because she said the viciousness in the health care debate could lead to violence. And in our 4th story tonight, Countdown has confirmed that, in fact, Speaker Nancy Pelosi and the rest of us do indeed live in another world from Cantor, a world known as reality. Meanwhile, in Cantor world, quote, I've not been anywhere over the last several months where I would even think such a situation where violence is in the offing exists. Because such situations have not occurred in Cantor world, they must not exist. So why haven't any of Mr. Cantor's town halls got even the slightest bit ugly? Perhaps because he held only 3 and they were all held on the telephone. His first public forum taking questions on health care was this week, bipartisan, diverse, and run by a newspaper rather than one of the right-wing groups fueling the behavior that has Speaker Pelosi so concerned. One woman there asked what to do about a sick relative who lost her job and now has no insurance to pay for the surgery she needs to remove the growing tumors in her stomach. Mr. Cantor had plenty of time to think about his answer while Democrat Bobby Scott responded. Mr. Cantor then explained Republican health care. First, sell everything you own, your house, your car, whatever, to pay your medical bills until you are poor enough to qualify for Medicaid, a government-run health care program. And if that doesn't work,
I guess I would ask what the situation is in terms of income eligibility and the existing programs that are out there. Because if we look at the uninsured right now, there is probably 23-24% of the uninsured that is already eligible for an existing government program that, frankly, the government has not done an adequate job at going out and making people aware and signing them up.
And if that doesn't work, get on your knees, stick out your hand, and beg for charity.
I know that there are programs, there are charitable organizations, there are hospitals here who do provide charity care, that if there's an instance of indigency and the individual is not eligible for existing programs, that there can be some cooperative effort. No one in this country, given who we are, should ever be sitting without an option to go be addressed in terms of health care. And that's really what I'm here to tell you. There are resources available.
Let's bring in Markos Moulitsas, founder and publisher of the Daily Kos and author of Taking on the System, Rules for Radical Change in a Digital Era. Thanks for your time tonight, Markos.
Always glad to be here, Lawrence.
You know, earlier Senator Coburn told a woman whose husband suffered traumatic brain injury that her neighbors should pitch in. Now we hear Eric Cantor saying turn to charity, but only after making yourself poor enough to qualify for Medicaid. I mean, isn't that exactly the kind of answer that would make reasonable Republicans in his audience think, wow, we really do need health care reform in this country?
Well, we really do need health care reform. And if there were any reasonable Republicans left, I think they would believe that. But unfortunately, that party has been taken over by this fringe teabagger component that's led by the Rush Limbaughs and Glenn Beck's of the Republican Party, who really believe that if you can't afford something, then you do not deserve it. That certainly applies to health care. So, you know, at the end of the day, there are no government programs that can help these people. There are no private charities that can help these people, because if there were, we wouldn't have this problem. We are having this debate precisely because the current system is broken.
Now, Congressman Cantor, finding himself talking to constituents about health care for the first time, also said he thinks that more uninsured people should take advantage of government programs run by government bureaucrats, something he usually inveighs against. Is he even listening to his own answers on this thing?
Well, intellectual consistency isn't exactly a strong suit of the Republican Party or any Republicans. But I'm sure Democrats would be more than happy to work with Eric Cantor to identify these mythical government programs that can help this problem and work to bolster them to truly solve this health care crisis.
You know, and he complained today about Democratic intransigence on health care, that the Democrats are roadblocking everything in the Congress because the only thing they want to do is health care. But in the Senate Finance Committee, we watched the Republicans all day long successfully slow that process to a crawl. So, I mean, who's really blocking who here?
Well, Republicans have no interest in reforming. That much is obvious. But I have to say, you know, you can't give a pass to those Democrats that are working hand in hand with Republicans to obstruct. I mean, the American people elected vast Democratic majorities in Congress to make this stuff happen. And if you're an insurance lobbyist, you know that Republicans have no power anymore. You have to go after certain Democrats, and they've done that very effectively. And a few handful of Democrats, unfortunately, are working hand in hand with Republicans to stop this.
Markos Moulitsas of the Daily Kos, thank you very much for joining us.
Thank you.